Hi, everyone. Thank you for being here today. I'll be presenting on the impact of healthcare access and socioeconomic factors on asthma outcomes among adults in New York City. The study examines how factors like health insurance coverage, access to primary care, income, education, race, ethnicity, and age influence asthma diagnosis and prevalence across different neighborhoods in New York City. The two main objectives of this study are to assess how healthcare access, specifically health insurance coverage and access to primary care providers, relates to self-reported asthma diagnosis. As well as the second objective is to focus on examining the influence of socioeconomic factors on asthma outcomes. I'll look into factors like income levels, education, race, ethnicity, and age to see how these variables might shape asthma prevalence and diagnosis in different neighborhoods across New York City. Um, let's start by focusing on some background information. Asthma is a prevalent chronic condition that affects approximately 25 million people in the US, or about 7.7% of the population. Specifically, Black and Latina communities face higher rates of asthma or worse health outcomes, including higher hospitalizations. In fact, asthma hospitalizations in areas like the Bronx and Brooklyn are nearly double the New York City average. It's important to note that environmental factors such as air pollution and housing conditions are well-documented risks for asthma, but one area that has been underexplored is how healthcare access, including health insurance coverage and access to primary care providers, contribute to asthma outcomes in urban settings like New York City. Lastly, socioeconomic status, which includes income, education, and other factors, can significantly impact asthma severity and access to care. Now let me walk you through the methods of the study. The data comes from the 2020 New York City Community Health Survey, a cross-sectional survey that is representative of the New York City adults. The total sample size was 8,676 individuals. The key variables included the outcome variable was whether an individual had a self-reported asthma diagnosis. The exposure variable included health insurance type and whether individuals had access to a primary care provider. The covariates include race, ethnicity, age, education, and poverty level or income. And to analyze the data, I used descriptive statistics and chi-square tests to assess associations. Additionally, we performed both bivariate and multivariate variable logistic regressions to model the relationship between healthcare access, socioeconomic factors, and asthma outcomes. I also included an interaction term between income and PCP access to explore how these two variables interact. And this was all done using SPSS software. For the results of the study, prior to adjusting for the covariates, this is table 1, which shows the distribution of socio-demographic characteristics among individuals with and without asthma. There is significant differences across several variables, especially in race, ethnicity, insurance type, and poverty level, all which shows a clear association with asthma prevalence. More specifically, Hispanic individuals make up a large proportion of those with asthma, and we see that those with private insurance have a lower asthma prevalence compared to those with Medicaid and those that are uninsured. There's also a strong association that individuals below the poverty line are more likely to report asthma. After adjusting for the covariates, there were a few differences from the crude results. First being the insurance type, which is significantly associated with asthma prevalence, and as well as educational status. After controlling for the other factors, the influence of education on asthma prevalence was weaker. And for the race and ethnicity, it did not remain the same or a significant predictor of asthma. As well as the interaction term between income and access to primary care providers, which was significant. This suggests that individuals with low income who do not have access to primary care providers are particularly high risk for asthma. A few key findings from the study include individuals with Medicaid or those uninsured had higher odds of asthma compared to those with private insurance. Access to primary care providers also increases the likelihood of reporting an asthma diagnosis. This suggests an idea that regular ongoing care through PCPs help in timely diagnosis and management of asthma. Income, specifically those below poverty line, are also a significant factor. Lower income individuals had higher odds of reporting asthma. While education and age did have some influence on asthma outcomes, their effects were more modest compared to healthcare access and income. And interestingly enough, after adjusting for healthcare access and socioeconomic factors, race and ethnicity was not significant predicting asthma outcomes. In conclusion, the study found a significant association between healthcare access and asthma diagnosis among adults in New York City. Specifically, insurance type and access to primary care providers were important factors influencing asthma outcomes. I also found that socioeconomic factors such as income and education contribute to asthma prevalence. However, there were several limitations to consider with the study. The study used a cross-sectional design, meaning the data collected at a single point in time. There may also be underreporting of asthma diagnosis and other factors in data as well. And there was also no inclusion of environmental exposures like air quality or housing conditions. Finally, I would like to acknowledge those individuals and organizations that made this research possible. Dr. Chloe Mirzai, the instructor of this class, for her guidance and support throughout the project, as well as New York City Health for providing access to the data, and CUNY School of Public Health for all the academic resources and environment to foster this research. Thank you.